Before we get started, welcome in. Great to see new faces here. Hi. I would like to announce that executive applications are open. So if you're looking to join AMWHO, now's your chance. You can find our linktree/AMWHO_OU. There is the application to join exec on there. It's a really quick Google form. For executive officers, we'll have interviews and as well as like a couple of short questions. For presidency, we'll be doing votes later next week. If it's something you're interested in but not sure about, come talk to me. Really cool. We want you to get involved. Hi, Joyce. No, don't talk to her. Anyway, introducing Raifa. Woo!
Okay, before I start off the presentation, I would just like to say the presentation has mentions of gun violence, police brutality, medical malpractice, and war. So if you are not comfortable listening to that, please tell me. All good? Okay. And you are more than enough welcome to leave if you have to. And also sorry if I'm out of breath, I'm fasting, so I'm tired. Okay, so first of all, I would like to introduce our organization, Student Coalition for Palestinian Liberation. We just formed the organization. There's Abube, she's a fellow team member. Everyone say hi, Abube. So the purpose of our organization is to advocate for Palestinians, irregardless of where they are in the world, and our purpose is also to educate and talk about anti-Zionism, and also to preface, anti-Zionism is not anti-Semitism. I just wanted to put it out there before we continue on. Okay, and also I would also like to reiterate, this is a presentation talking about the health conditions of Palestine. I will be going into the political climate and the conflict a little bit, but I won't be going too much into depth. But I'm assuming, you guys might need a historical context into what I'm about to present. So, okay. So conflict and health, Palestine. Okay. So first of all, I would like to start off this presentation with a story that I read. This is a quotation I took from the story. So the patient's situation is seriously deteriorating. The operation is urgent. So the PHRI is an organization called the Physician for Health. We'll talk about this later in the presentation. But it's an Israeli nonprofit organization that advocates to help Palestinians within the occupied territories. So I'm gonna read out the story for you guys. 53-year-old Tariq suffered from severe headaches. An MRI scan conducted in Gaza on 22nd of June 2016 identified a suspected cancerous tumor. Tariq was urgently referred for tests and surgery at the Augusta Victoria Hospital in East Jerusalem. And it was scheduled for the 7th of July. His permit was turned down. PHRI turned to the Israeli authorities and said that, and submitted a medical opinion. The operation is urgent, they reiterated. Tariq was then requested to undergo an interrogation while he was very sick. After he presented himself on 6th of August on a stretcher, he was kept waiting for several hours before being dismissed. No permit was given to him. Only after the PHRI intervened for a second time was he given permission to travel on the 15th of August, more than a month after the initially scheduled surgery date. After the operation date, where the tumor was indeed found to be cancerous and extremely debilitating to Tariq's health, Tariq was then invited to a follow-up chemotherapy, his first chemotherapy after being diagnosed, but once again faced delays each time he applied for a permit. At the end of 2016, he was in a critical condition in Augusta Victoria Hospital. So I wanted to start off this presentation with this story because I feel like it sets into place how difficult it is to get access to healthcare, especially if you are living in the occupied territories of the Gaza Strip, the Golan Heights, and the West Bank. So, okay. First off, I would like to provide some context on the conflict, history, and the geography of Palestine. Okay, so this is like the general area of where Palestine is located. It's here. Google Maps does not show Palestine at all. So like this little bit is the West Bank, and there's like a little strip here, which is the Gaza Strip, and the little like section here is the Golan Heights, which is technically Syria, which Israel occupied as well. And this is a little bit up close. So this is now the boundaries with like the occupied territories today. So this is the state of Israel. This is Gaza. The dotted lines is because like there is no set boundaries between them. There's the West Bank, and I think you can notice like little speckles of the color here. So even though this is the assigned land to the Palestinian people, Israel has been slowly implementing like settlements in there, which slowly like cages in the Palestinian population in there. So hence why this like darker color is like where the Palestinian people live, and this is Israeli like settlements. No, actually it's the opposite, sorry. Okay. So this is like the timeline of events. From 1799 to 1946, the British mandate for Palestine laid the essential groundwork for a Jewish state to be established in Palestine. So this is also in collaboration with the International Zionist Organization, which sought to establish a Zionist ethno-state. And then in, sorry. Okay. Oh, also, if I mention like any word that you don't know, please like ask me, because there's like a lot of terminology that you guys might not know. So the first highlighted circle is when the first Nakba took place. A Nakba is an Arabic word which means disaster, catastrophe, or cataclysm. So during the Nakba, which took place in 1948, a lot of Palestinians were expelled from their homes, and a lot of Palestinian land was seized by the Zionists. So 80% of the Palestinians were expelled, and 80% of the Palestinian land was seized by the Zionists. And following that year, 150,000 Palestinians remained in Israel and were eventually given citizenship. However, they were subject to military rule until 1966. And after the second Nakba of the West Bank and Gaza Strip in 1967, Israel began its military control over the Palestinians living in the occupied Palestinian territory. Okay. And it continues on. So in 1967, that's when the Israeli state truly began its like military control over the Palestinians. Continues on in 1968, Israel began implementing settled colonial policies in the West Bank and Gaza Strip. These colonies, Jewish settlers are allowed to carry weapons fully like open under the protection of the Israeli military or the Israeli army. In 1987, after 20 years of brutal military occupation, the first Intifada began in the occupied Palestinian territory. So just to clarify like some terms here, so settler colonialism means it's a type of colonialism which the indigenous peoples of a colonized region are displaced by settlers who permanently form a society there. So it is the settler colonialists are people who either migrated from Europe after the Second World War and settled in land that had Palestinians in them, or they just moved in from like other regions of Israel after the first Nakba. And the Intifada means a Palestinian uprising against the military. So the first Intifada happened in 1987. Following that, this is when the Oslo Accords took place. So there were negotiations between the PLO. PLO is the Palestinian Liberation Organization. And it concluded in 1993. So what they signed was, it was the first time Israel and Palestine formally recognized each other as nations or states. So on September 13th, 1993, Israeli Prime Minister Yitzhak Rabin and Palestinian Liberation Organization negotiator Mahmoud Abbas signed a declaration of principles on interim self-government arrangements, recognizing each other as like separate states. And this is referred to as the Oslo Accords. And it, for a fleeting moment, raised hope for there being like peace within the states. But however, like after 2014, things have not really changed as much. I don't know if you guys remember, but there was an incident of settler colonialism in East Jerusalem last year during May. It was the Sheikh Jarrah like evictions, where a predominantly Palestinian neighborhood in East Jerusalem called Sheikh Jarrah, a lot of people were being expelled out of their homes, and their homes were then given to settlers who were coming in from regions of Europe or Latin America. Okay. Okay, part 2, which is access to healthcare within the occupied territories. The occupied territories being the Gaza Strip and West Bank. So the pandemic happened and Palestine suffered so much from it. But there was like a little tinge of hope that both states would be able to cooperate in the wake of like the new enemy, the COVID virus. So both states cooperated closely within the first month of the pandemic and then managed to contain the spread for a little while. And then, I mean, even before it hit, the Palestinian economy was really bleak, with the GDP per capita projected to decrease by 3% to 4.5, according to the report that is mentioned there. So after like the initial like year of the pandemic, the vaccine was starting to get out, and Palestinians living in East Jerusalem have the right to Israeli healthcare, and they pay Israeli taxes and all that. But Israel was very hesitant to give the vaccine care that the Palestinians living in the occupied territory wanted. But they did offer the vaccines to Palestinians living in Jerusalem. So because of this, Gaza suffered a lot, and they did not have access to vaccines until so much later. They mostly got aid from elsewhere. So like international aid and so on. Also, I forgot to mention this. The healthcare system in Palestine is like very complex and fragmented across the country. So the basic health and primary resources that are offered to Palestinians are the Palestinian Authority's healthcare, the United Nations Relief and Work Agency for Palestinians or UNRWA, non-governmental organizations and NGOs, and private healthcare services such as like pharmacies or clinics, but not much from the Israeli government. They just like rely on like other sources for healthcare. And within international humanitarian law, that as an occupying power, Israel is responsible for the health and welfare of the Palestinian population under its control. This includes ensuring the population's access to adequate medical treatment, ensuring the medical supplies, and ensuring and maintaining medical establishments within the settlements. Okay, moving on to psychosocial health. In a study like conducted, like I have the source in the back, Palestinians are particularly at a higher risk for developing anxiety disorders compared to like other regions of the Middle East because of the prolonged exposure and displacement of their people, and also the limitations on professional education and financial opportunities that they do not have within the occupation. Lack of feeling safe is the main cause of mental disorders such as anxiety, phobia, depression, and PTSD. The percentage of kids in public schools in Area C, which is the West Bank, this way, which is managed by the Israeli military forces, suffers from psychological conditions and social difficulties. Around 34.6% of the children, which mainly consists of Palestinian children, and 69.4% after a lot of like drone strikes and all that in 2011. Unfortunately, like Palestinians don't give much importance to mental health care because they don't have the necessary education and they lack access to good mental health professionals which are able to help them. And moving on to reproductive health in Palestine. Political instability have been associated with an increase in maternal mortality registered in Gaza, a ratio of 27 maternal deaths per 100,000 live births. The MMR, or the maternal mortality rate in Israel, is 3 compared to 27 per 100,000 live births. And the US is 19, just like 18 less from Palestine. A 2016 UNFPA study on family planning showed that trends in family planning method choices were associated with the unavailability of skilled midwives. Skilled midwives don't exist in Palestine because they don't really have the education that requires to produce skilled midwives. Currently, there are 3,000 midwives less than needed to provide adequate sexual and reproductive health services. Thinking about sexually transmitted infections within the youth of like Palestine, it is severely underreported because of cultural reasons and religious reasons and all that. The HIV/AIDS prevalence remains relatively low. Of course, again, it all comes down to how much sexual education that the society has. And it's also because of the lack of sexual education, which might lead to increase in incidences of STDs. But again, we don't really know the exact numbers because people either don't report it or there's just a lot of like logistics issues. Okay. Okay, this is a very important part of the presentation. A lot of accessibility issues come from the checkpoints and barriers within the occupied territories and in Israel, Gaza, everywhere within the region. So the Palestinian residents need medical care outside of their region of residence require an exit permit from the government of Israel. And the likelihood of you being, if you are a Palestinian living in the occupied territories, the likelihood of you being rejected is 1 out of 3, which is a lot. And a lot of Palestinians suffer from a lot of health conditions because of the conflict. And it is very unlikely for them to get the medical care that they need because they need an exit permit. Gaza is described as the world's largest open-air prison because it quite literally is a prison. You cannot exit or get inside Gaza without the permission of the Israeli government. This is primarily an issue for residents of the West Bank and Gaza, who are often referred to treatment in East Jerusalem, where the most advanced Palestinian hospitals are located. So Gaza is like there, and East Jerusalem is there. And Jerusalem is under the occupation of Israel. And to travel, you need a permit, and that does not really happen. Residents of Gaza are also often referred to hospitals in the West Bank, and there's also like a strip of Israeli land in between them. And again, you need a permit to travel through that. Okay. Obtaining like Israeli permits is a process that is, as stated by the WHO, neither transparent or timely. If you apply for a permit like today in Israel, you will be able to receive it like months later. It's not, they don't have like an urgent response system or anything. It's just like way too late, and the patient is also like in the end in like very critical condition. Okay. So why do they refer patients to East Jerusalem? So East Jerusalem, as I mentioned before, has the most advanced Palestinian hospitals in comparison to Gaza right here. So Gaza does not have the capabilities to treat cardiac surgery. They don't have specialist cancer care, specialist oncology treatment, children's dialysis, nothing, nor does the West Bank. So, and consider these are the regions where most of the Palestinians live, and they don't have these resources. And they all are located under East Jerusalem, which is the Palestinian section of Jerusalem, which I think should be like right here, which is under the Israeli occupation. And over 50% of patients in East Jerusalem's hospitals are referred from the West Bank or Gaza by the Ministry of Health in the Palestinian Ministry of Health. Okay. So there are movements within the state of Israel for accessible healthcare. These are mostly led by Israeli activists who are against the occupation. So I just want to mention two movements that really struck out to me. And this picture is a picture taken in 2003. Abu Dis is a woman who's like a new mother, and she's climbing over the first phase of the wall in Jerusalem to get to school and work and shopping. And she does this every day. So I just wanted to like show you this as well. Okay, so the first organization is the Road to Recovery. It is an organization with a lot of Israeli volunteers who mostly assist Palestinians by like driving them to like hospitals and stuff, mostly children. And because they're Israeli and they are in like an Israeli vehicle, it's much easier for them to transport people from the territories to Israel. And the second organization I wanted to mention is Physicians for Human Rights Israel. It is a non-profit organization founded in 1998 by a couple of like Israeli physicians. This is the organization that I talked about before when I talked about Tarek's story. So yes, these are two organizations that are currently operating within the occupation to help Palestinians get the care that they need. Okay, for part 3, I would like to discuss actions that United States and like us as like individuals could do or think about for better access to healthcare for Palestinians. So this is very long. Okay, actions for the United States. As you guys might know, Israel and United States are like this, you know, they're really close. The United States funds most of the IDF. I mean, like 90% of the IDF funding comes from the United States. Your tax dollars are going to it. Okay, so placing pressure on the government of Israel to remove the obstacles to the right of movement which undermine access to treatment. This should include freedom of movement of patients and their companions to treatment within all areas of the occupied Palestinian territory, which is Gaza, West Bank, East Jerusalem, including ending the restrictive permit regime, which hinders access to adequate care. So the permit regime is when, you know, you apply for an exit permit to get out of the occupied territories, but you don't get it. That is what I meant by the restrictive permit regime. Secondly, allowing the free movement of ambulances and removing the policy of back-to-back ambulance transfers. So back-to-back ambulance transfers like refers to, so you are in Gaza, you want to go to East Jerusalem. They take you to East Jerusalem, and if you are able to make it to East Jerusalem with an exit permit, you need another exit permit to go back, you know? So that is the back-to-back ambulance transfers. At checkpoints, which causes dangerous delays to patient care. Thirdly, working through bilateral and multilateral engagement towards ending the blockade of Gaza and separation between the West Bank, Gaza, and East Jerusalem. Such efforts should pay particular attention to removing barriers to effective medical treatment, especially the impediments to the development of the Palestinian health sector within Gaza. Okay, so now you're sitting here and thinking like, what can I do as an individual? Okay, don't stop talking about Palestine. Don't stop. Like, this has been going on for almost 74 years now, and we talk back and forth. I mean, the fact that the conversation is still there makes a huge difference. So even if you don't really know much about Palestine, like, try talking to your friends about it and you might learn from them. So don't stop talking about Palestine. Learn and ask. If you feel like you don't know much about Palestine and you want to know more, just attend our events. Yes, attend the SCPL events. We'll be having some soon. We will be tabling next week at the union. Please come up to us. Ask somebody who knows better or who you think like knows. Ask questions. Don't be scared to like ask questions. I know this is such a huge and complicated issue, but you're not going to learn anything if you just don't ask anything. So ask questions and learn. Support boycott, divestment, and the sanctions movement. It is called the BDS movement. So boycott, divestment, and sanctions means that we essentially halt all like international funding to Israel. That may include, that may include like, I don't know, there are like trips to Israel, birthright trips and all that, which are all like funded by the US government. And brands like Starbucks or Ben & Jerry's, which unfortunately, yeah, which unfortunately also funds the IDF and the Israeli military. Learn about the boycott, divestment, and sanctions movement. Learn how you can impact them, impact a change and all that. And lastly, be unapologetically pro-Palestine. I cannot stress this enough. There are currently 4 million Palestinians within Gaza, and I think 1.7 million Palestinians who are displaced around the world. And it should not be that way. Palestinians deserve the right to exist, and slowly they are fizzling out of existence. So ask questions if you feel like you are in doubt whether you should be pro-Palestine or not. Attend our meetings. And yeah, so okay, that's it. Thank you. Okay, I open the floor for questions.
Can we people over Zoom make a comment?
A large percentage of the, I mean, I don't know exact numbers, but I do know that a large percentage of their profits go to fund Israeli military like purposes, so which is not like great. But then again, you cannot trust corporations in general. Yeah. So okay.
Do you know if the funding, by Starbucks is like directly, or is it through like taxes collected from them?
It is. Do you know anything?
All I know is that these corporations operate within the occupied territory, so they profit from occupation. So Coca-Cola is a major one. So just look at the brands that you buy.
Please visit the boycott, divestment, and sanctions website. They have so much information on like the brands that are complicit in the occupation.
I don't have a question. I just want to point out you might have questions in the chat.
Oh, okay. Thank you. Oh. Oh. Oh.
Text back and be like, "Someone can hear me."
Can we make a
Okay.
comment?
No.
Hello?
Oh, okay. Okay.
Also, stop share if you'd like to see them, if that helps. Oh, somebody just left.
Oh.
Bye.
Okay. Mukarram. Hi, Mukarram.
Is it true that the US military like sends weapons to Israeli military? Like, I remember hearing that somewhere.
Yeah. When I say like Israel and the US are like this, they're like this, they're
Yeah.
besties, you know, they send money, they send military, like guns, everything, weapons, everything to Israel.
So are there like,
Sorry. No, no, go ahead.
are there like organizations that we can donate to? Like,
to help, like medicate, like get medical help towards Palestine? Like the ones you mentioned, can we like donate towards them? Would that help?
I think, I don't know if people are from
I don't know how to fix this.
Everyone wants to try.
Raifa, can you hear me?
Oh,
No, okay.
The volume.
Let me hear. Sorry.
Can you hear me?
Technical difficulties.
Sorry for that, folks.
Oh, they can't hear us?
Sam, can you try talking?
Can you hear me?
There are people trying to
No,
talk.
it's nobody.
Hmm.
Try again.
Can you hear me?
Yes, awesome.
It's quiet, but there you go.
Okay. Hi, Raifa. How are you?
how are you, Mukarram?
I'm good, thank you. Thank you guys so much for holding this event. It's so wonderful, very informative, and I hope people learned from it. I just have a couple of comments to contribute. The first thing I want people to know that this is not a complicated matter. It's very simple. It's very, very simple. But the media is always trying to portray it as a complicated matter. It's literally ethnic cleansing. It's settler colonialism. It's as simple as that. It's really black and white. There's no gray area in the story. It's an attack on the indigenous people. It's ethnic cleansing of indigenous people. And that's what the Israeli government has actively been doing since 1948, since the establishment of it, right? That's the first thing. The second thing is, I just heard somebody saying that like where Palestinians are fizzling out. We're actually not. The Palestinian population is growing much more than the Israeli Jewish population, which is why the state of Israel called us a demographic threat. They literally call us that. So, so that's another important thing that people should know. And in terms of support, I heard some people wanting to donate. That's wonderful. There's like so many organizations that you can donate money to, but really the most important thing is to speak about Palestine. To like the last slide that said, be unapologetic. It's an issue that a lot of the world issues and oppression that centers around, right? And definitely, please do support BDS. The only goal of BDS is to put enough pressure on the government, the Israeli government, to end the occupation. That's the only goal. It's not about committing harm or to cause harm against any one individual or one company or one organization or any one individual human being. It's literally about the ending of the oppression of the Palestinian people. That's the only goal. And I, as a Palestinian, always say that's in the Israeli occupation today, and tomorrow I will be buying all kinds of like Israeli things, you know? So it's not about the product, it's not about the company or one individual, it's about ending the oppression. That's the only goal. So that is, when people talk about BDS in such a demonized language, please do mention that. That's the only one non-violent way that we have at our disposal to use to end our oppression, right? So please do learn about BDS. Just Google BDS movement. You'll have the website pop up. There's all kinds of information there. That's very easy to understand, very straightforward, and makes things so much more clear than what the American media portrays to the American society in general. And that's it. And again, thank you guys so much for holding this. I'm very excited for so much more to come.
Thank you so much, Mukarram. Okay, does anyone have any other comments or questions? No? Okay, I guess we're done now.
Okay, thank you. That was good.
Thanks again. that's all for our meeting. Thank you again for being here. We'll have our exec right after this. And then here at like, I don't know, 8:30, we'll have a quick meeting on harm reduction and the upcoming syringe takebacks. If that's something that interests you, feel free to stick around or go hang out and come back.
Also, this is a reminder to follow at ou.scpl. Please follow us. Please come to our events. We will be